There we go. Good morning, Bob. How are you today?
Hey, good morning, Tammy. I'm great. Very good. Nice to see you again.
Nice to be seen and nice to see you. We had a little conversation before hitting record about our start to the day.
Yeah.
One fun thing about you and I is we have a few things in common. We have our desire and passion to help people around us, specifically
True.
those who are living with Parkinson's. And we also have big furry animals in common. So
Yes, yes, we do.
you have
And
two,
I
right?
have I have two Great Danes, yes, and I know
Mhm.
you've got a couple yourself.
I do. I have two giant schnauzers and one dachshund. But I think on mornings we had a really rainy, stormy morning, and you would think that my giants were tiny little doggies who were afraid of their shadows because they did not want to get
Yes.
wet. They did not want to get out in that thunder. And they made our
Nope,
mornings
nope.
interesting, didn't they?
That we were the only ones standing out there in it. They were smart. They stayed inside. There was no convincing them to come out. No way.
It's amazing, isn't it? Like it's amazing. And I just give up and I gave in, so they still
Yeah.
have me around their finger, if that is a thing. But anyway, with that being said, we had a great time getting together on Friday with our
Yes.
Power with Parkinson's people, and it's been a long time, so I'm glad we're back at it. And we covered
Yeah,
a
me
couple
too.
of topics. You specifically covered one topic on pill load, medication, hospital stay, some great advice that we'll get to next. But
Hmm.
let's jump into the topic of exercise and medication,
Yep.
because that's where we really do find ourselves as a fantastic team. With Parkinson's, you
Yes.
need both. You a lot of times in other situations, you can maybe use exercise or get healthy and then not have to rely on drugs and medication. Or sometimes medication helps you and you don't have to be as vigorous with your exercise, although you should always exercise. But with Parkinson's,
Hmm.
both are essential and what's the lack of a better word, non-negotiable, right?
Very true. Very true. And to your point, very often in other disease states, let's say, for example, high blood pressure or diabetes, and the patient gets into a fairly rigorous exercise program, drops a significant amount of weight. It would not be uncommon for the physician to see that patient several months later and say, "Hey, look, you've changed things around. Let's see if we can reduce some of your medication, or lower the dose of one of your medications, or eliminate one of your diabetic medications because your blood sugar and your A1C has improved so well." And you see this especially when patients undergo, let's say, gastric bypass surgery and they lose a ton of weight. They come off of almost all of their diabetic medication. So, case in point, I mean, it works great for a lot of other conditions, but as far as Parkinson's is concerned, it's it they're coupled together. One's not a replacement for the other.
Right. Can you give us a little bit of an explanation of the why behind that? Why can't I reduce my Parkinson's medication if I get more physically fit?
Yeah. So, and this comes up all the time, and I understand it. I get it from their point of view, but unfortunately, Parkinson's is a progressive disease by definition, and we have to stay vigilant about that all throughout the journey through Parkinson's because it's going to be around for years.
Right.
So, patients need to understand that the exercise, although it's extremely transformative, certainly more so than the medication in certain respects as far as their symptoms are concerned. Uh, but it's essential to tie it in with the medication because it's that medication that's enabling them to go to the gym and have that flexibility and in order to do the exercises that they're doing. So I can understand where patients get into that trap where they say, you know what, I've made tremendous improvement ever since I started the exercise. Maybe I don't need my levodopa carbidopa anymore, or maybe the doctor can reduce it. And yeah, that's a possibility, but I'd find it highly unlikely that the neurologist is going to just rely solely on exercise and begin to decrease the dose of levodopa. It's very rare that that happens.
Right. And I mean, it's a different kind of disease. It's not a disease that's set off by the lack of exercise or the lack of,
Mhm.
you know, being heavy or overweight or anything like that, or lack of
Yes.
something you've done. It's a disease that actually doesn't discriminate based on that activity level prior,
Sure.
unlike other diseases that are onset from just bad health choices.
Yeah. And you know what? Many times, and of course we've spoken about the onset of Parkinson's is usually later in life, around the 60s. So we have many other comorbidities that go hand in hand with that. Just age-related things like blood pressure, diabetes, high cholesterol. But if they're in an exercise program, a lot of times those symptoms do see significant improvement. So
Right.
they're feeling better, they're getting much more out of their exercise routine. So it kind of leads them down a false path to saying, hey, you know what? Maybe I don't even have Parkinson's. Look at how much better I'm feeling or I'm doing. Um, and the opposite is true too. Many times I've seen patients who are diagnosed and then they go to their neurologist, they get on, let's say, levodopa, carbidopa, and their symptoms are well managed, where they're out doing pickleball or they're playing softball or their golf game's improving. And they're saying to themselves, why should I go to the gym and beat myself up 3 or 4 times a week? And all I got to do is just pop this pill 3 or 4 times a day and I'm good to go. So that doesn't work either. So,
Yeah.
one of the things that I brought up in Friday's presentation was my kind of brick and mortar hypothesis. You know, where if you want to get a good, strong structure, you need to build it out of brick, but you need the mortar in between each layer to cement it and to make it nice and strong. And that's the
Right.
concept with exercise and medicine in Parkinson's. You need that 1-2 punch in order to truly reap the benefits.
Absolutely. And and exercise does seem to, and you mentioned it already, it helps with the symptoms of Parkinson's. It helps keep them at bay. Sometimes it even has shown to reverse symptoms of Parkinson's. There are people, and we've actually spoken and interviewed a couple, you and I ourselves, who could not do one thing prior to getting into a customized specific exercise routine with the Power of Parkinson's program. And then after getting into it, could do things that she couldn't do before. Stiffness went away, flexibility increased,
Sure.
tremors decreased, energy level increased. So they are truly, we can see some of your Parkinson's symptoms, just like you said, get better, maybe even reverse, so to speak, a little bit. And
Mhm.
that's awesome. And that's the goal. The goal is your medicine, your exercise, so that you can have that amazing quality of life, because you can
Absolutely.
with Parkinson's.
For sure. And
Yeah.
as I said before, the medication, especially levodopa carbidopa, it is the gold standard. It's used almost exclusively in Parkinson's, and it does work. It works all the time. Yes, we do have to change the dosage and the frequency, but it's great for managing the symptoms. But that's
Right.
just it. It's the symptoms. These pills, the medication that we have, they put those symptoms on hold for 4 or 6, or some cases as long as 8 hours. But they're going to return for sure. If they don't take that next dose, it's coming
Yeah.
back. With exercise, we have found, especially with aerobic exercise, that we can improve the motor symptoms, the slowness, stiffness, and tremor, even the postural instability that patients see. We can even make improvements with the non motor symptoms. For instance, cognition. Here again,
Hmm.
this is an area where aerobic exercise has done wonders for. We can also see improvement with sleep, with mood, with constipation. Uh,
Hmm.
Huge improvement with that, especially when we get that pelvic floor engaged and the muscles in the lower extremities. That certainly helps with peristaltic activities. So
Yeah.
there isn't any drug on the market, I can assure you, that does all of that. As we said, if exercise came in a pill, we'd all be swallowing it all day long. It would be a wonderful thing, but it doesn't. You
Yeah.
have to work at it, but it is more transformative as far as making change than just the medication alone. We don't have drugs that can provide any level of what they call neuroprotection. So protect whatever existing neurons we have that are producing dopamine. We would like to protect them and save them. We don't have a pill that can do that yet, but we have seen evidence where exercise can do that. It can also increase what we call neurogenesis, which is the production of new neurons and new connections that get made. Here
Right.
again, there's no pill that can do that. So for sure, you need that exercise in combination with the medication in order to achieve all of those benefits. And I think patients will see when they get involved with the exercise program on a serious level, with trainers such as yourself that know specifically what Parkinson's patients need, rather than just haphazardly let them walk in the gym and say, today I might do the treadmill for a few minutes and then I'm going to do the leg presses or something else. They need more structure than that.
Yeah, and I'm glad you brought up that because the actually you brought up the two things that I would steer people from, the treadmill and the leg presses. And
Perfect.
so and the neat thing is, and then this is why. So you said specific Parkinson's exercises, uh, those that do help us cognitively, right? Things that make us think while we're moving, right? Something
Yes.
with Parkinson's is you have to actually now you have to turn, like you have to think a lot more with everything you do. Everything has to become more of a conscious effort. It stings, before we could put one foot in front of the other without having to really think about putting one foot in front of the other. Yet with Parkinson's, more effort and more conscious effort to some of those activities or most of those activities is required. Now, with you see it all the time. We hear there's boxing with Parkinson's. Yeah, so like
Yes.
that reason why that's so good is it hits that cognitive level. You are now required to create combinations and different types of punches, so you have to think before you hit, think before you move. Sometimes it's really quick and jerky, which is really great for that brain. It like lights up, but like all those neurons are firing
Yes.
as you create
Yes.
combinations.
Absolutely.
Helps with coordination. And so making your exercise actually more of a thoughtful exercise, more of a challenging mind game while moving exercise is, even without Parkinson's, it helps for neuroplastic change and performance enhancement. So that's one reason why boxing has always been really, really encouraged with Parkinson's. Another one is the sensory receptors on your hands. You get a little sensory overload, so your brain's even more excited to have that sensation, the additional, not just motor activity but sensory activity.
Yes.
Now with Parkinson's too, there's a couple of things that people with Parkinson's, and you've said it many times, slowness, stiffness, those things come with
Tremors. Yeah.
Parkinson's, tremors. But the slowness and the stiffness, I think I don't know if I've met anybody with Parkinson's that didn't have those two things. Some
Yeah.
might not have as obvious tremors, but those come a long way with Parkinson's. Um, and that's where I would steer people from the leg press, from treadmill. Stiffness also creates a little postural instability.
Oh,
We see a
absolutely.
lot of Parkinson's posture.
Yes.
And when we
Yes.
do activity that encourages this forward crunching kind of posture, right? So if you're on the leg press, right, what are you doing? You're like this.
Yeah. There you go.
But you can get stronger with the leg press. You just have to be very conscious. You have to push your butt back as far as you can, lift your chest high to work that postural stability. Otherwise, you're going to encourage that forward kind of frumpy posture. And with low back pain, now, I haven't seen it written down that back pain is a symptom of Parkinson's. Um, but it's so almost everybody has back pain with Parkinson's, it seems, but I'm sure it's with the stiffness. I'm sure they go hand in hand, right? And so again, that good form on something like a leg press where you're adding resistance and potentially slouching in a seat could actually hurt your back worse.
Yeah.
And that's where
That
the
makes
treadmill
sense.
comes. Yeah, and that's where the treadmill comes in. If you, balance becomes a concern with Parkinson's. And so a lot of people who are on the treadmill want to hold on. And if you're
Yes.
holding on a treadmill, you're inhibiting that natural motion that we're created to do. And there's movement there, right? You see my
Yes.
shoulders moving, my torso moving. And if we restrict our upper body, that movement is there. It's just going to go straight to that lumbar pelvic hip complex and encourage back pain.
Yep.
So, so,
And that's a great point about the treadmill as far as moving the upper body, because a very common condition that occurs with Parkinson's patients, especially those that have that bent over posture and they
Mhm,
don't move their arms, they get this frozen shoulder
mhm,
situation that happens very commonly with them. I've seen it many times when I've spoken to patients that some of them had to actually have surgery because of it, and that's because they're not moving those arms when they are walking.
right.
Their gait is completely not normal. So that becomes a huge problem for them. So something like that, or any of the exercises I know you do that get those arms moving and get those
Mhm.
shoulders engaged, can really be dramatic for them.
Yeah, yeah. So there's lots of and there's lots of great exercises for people with Parkinson's. So I don't want someone who has Parkinson's to go to the gym and feel discouraged and think, is this going to hurt me? Is this going to hurt me? Is this going to hurt me?
Yeah.
But the advice of actually getting something that a professional, or even just doing some research to the absolute best exercises to get your heart rate up safely, to help you with your posture, to help build muscle and balance while encouraging good posture. One lesson I like to share with everybody is when you think about, the stiffness and bad posture, right? You think about, like if you're watching a slouch forward a second and feel the muscles that are contracted, right? Your chest muscles, your stomach muscles, your hip flexors, everything's kind of pulling forward. We don't need any help with this. So we want to think of the muscles that pull us backwards. And those
Mhm.
are the muscles to think about. Those are the ones I'm going to spend all my attention to. These don't need any help because they do a good job doing this. I don't need to help. I don't need to encourage them anymore. I need to
Right, right.
encourage these muscles now. So your back muscles, your backside muscles, your hamstring, opening your chest, building your lats, and all, those postural muscles are really would be the focus of anything you need to do at the gym. And most of us who are aging, that needs to be our focus
Yeah,
anyway, not just
absolutely.
Parkinson's, but
Absolutely.
more so with Parkinson's for sure.
Yeah, and again, some of the key points as far as that's concerned is that we're improving balance, which is
Mhm.
always one of the most important things, because without that balance, they're going to fall. And
Right,
falls, as we've spoken about many times, can be extremely dangerous for any Parkinson's patient.
right.
Also, their range of motion gets improved. Which again, range of motion, that now their gait, instead of shuffling, they're actually taking real
Yeah.
steps as they move along, as their range of motion goes up. Their cognition improves. I've seen trainers have them as they're working out, they're telling them, I want you to count backwards from 100,
Mm.
or name me every model of Ford cars you can think of, or do something like that while they're actually exercising to get that cognitive activity going up in the brain. Nothing too hard, but just something that they've got to actually concentrate on and be able to do two things. Multitasking is very difficult for Parkinson's patients. You
Right.
give them three tasks to do, you'd be lucky if you get the first one done. And then after that, it's going to be very difficult. So cognition is always an issue. And of course, overall strength that we spoke about the other day. And God forbid if they do fall and they are alone, they need to be ensure that they can at least get them right themselves in some way.
Right.
And
Absolutely.
that's important too. So we have to always, and I know you guys focus on that. Sometimes the patients don't even realize all the exercise, the benefit that they're doing, but I know you guys have it all structured in such a way,
Right.
which brings me to the point of why exercise, the 3 points that we brought up about it being planned. Number one, that you're going to
Right.
go every Monday, Wednesday, Friday, or whatever. It has to be planned out. It needs to be structured. As you said,
Right.
we have to do certain things and certain things we don't want you to do, which are going to be more harmful than good. And then finally, it needs to be repetitive. They need to keep coming back and doing it over and over and over again
Right.
if they're going to want to see it. And you know what? They didn't, those muscles did not change overnight. They didn't decompose overnight, or decondition themselves. They're not going to get reconditioned overnight either. So it's going to take an effort on their part. But if they stick with it for a decent amount of time, they're going to see the benefits. I can promise them that.
Yeah. Yeah. Absolutely. And the repetition, that's where change happens. That's where the multitasking becomes a little bit easier, like when
Yeah.
you do something, and that's for all people, but especially if you've got a
Oh,
challenge ahead
absolutely.
of you,
Absolutely.
you don't do something once and become a master of it, doing it over and
No,
over and over
no.
again. And, and the biggest thing I would say, and I got another question for you in a second, but the biggest thing, um, is with Parkinson's, there's a good possibility you're going to wake up and you're not going to feel like it. I mean, it's just a motivation thing. And that's where determination that no matter how you feel, you go. You're going to feel better. And the beauty of exercise is it does release like an adrenaline high or some kind of a high, usually after the exercise, that actually
Yeah.
gets you more energy and gets you more excited and all that. So knowing that it's so good for you and knowing that if you're not feeling like it, you're not alone. Probably everybody who shows up for class that morning, they didn't feel like it. That's part of Parkinson's. The motivation is a challenge. And so
Yes.
you just do it. You just you got to knowing that there's people
Yeah.
there, there's something there that's good for you. That's important. One question, Bob, real quick. This is the important one. We covered this in our last video but I think there's a lot of new people in our group since then. And that is, you brought up an analogy one time about a car going, that's driving
Yes.
55, now it's going 85. I'm just going to leave that little lead to you and let you take it away.
Yeah, yeah. So one of the examples we were talking about was some patients feel, or I've asked the question, I feel worse when I exercise. Because of my Parkinson's. And they want to know, is the exercise hurting my Parkinson's? Is it making my tremors worse? Is it making my stiffness and slowness worse? The answer to that is no. What they're experiencing more than likely is a significant drop in their dopamine levels because now they have engaged all these muscles that they wouldn't normally have done on days that they're not exercising. We have to realize and keep in mind Parkinson's is a movement disorder, and dopamine plays a huge role in that. So, one of the analogies I use very often to make the point clear is that look, if you took your car into the gas station, filled it up with gas, got in it, and then went down I-75 at 85, 90 miles an hour, you're going to burn through that gas much faster than the guy who filled up their tank, pulled out, and only did 50 miles an hour all the way down I-75. And it's the same thing with Parkinson's. If you're going to wake up in the morning and then if you're going to go box for an hour, you're going to go burn through much more dopamine than you would have if you were sitting home watching reruns of Judge Judy, for instance, right? So it's going to make a huge difference. And on those days, so what happens with some patients at the end of that hour workout, now their dose may still be an hour away, but they've used up so much more of their dopamine because of that vigorous exercise that they're now beginning to switch off. And some of their baseline symptoms are beginning to return prematurely. And they credit that with saying, oh, it's the exercise is making the Parkinson's worse. No, it really isn't. It's just your levels have dropped, and it's an easy fix. If you just reach out to your neurologist, explain to them, look, on workout days, here's what's happening. They've got a lot of tools and tricks in their tool bag to share with you. We have inhalers, rescue inhalers that some patients can use right after their workout. That gives them just enough kick to hold them over until their next regularly scheduled dose. Some doctors may tell you to take maybe a half a tablet, or some combination thereof. It's going to be different for every patient depending upon what their usual doses are, but it's never an excuse to stop the exercise. It's an
Right.
easy fix, and it's just a physiological demand that's been placed on the body, that we can fix that. And as I've told patients 1,000 times, look, we don't in Parkinson's, we dose the patient. We don't dose the clock. That
Right.
clock doesn't have Parkinson's, you do. So many times you're going to run into a situation where sometimes it's just not lasting the 4, 5, or 6 hours. So you need to have a plan B when that happens. And that's an easy thing to do. Doesn't You could probably just handle it over the phone or a telemed conversation with your
Mhm.
neurologist and say, look, here's exactly what's happening and how long it's happening for. Can you help me get through this so that I can keep up with my regimen? And they will. They get this question all the time. It's very, very common with Parkinson's and exercise.
Yeah, and that's great advice because I mean, I've said before where I've had clients after we train, their wives or their husbands will tell me that they go home and they nap for 2 and 3 hours, which that's not the goal. The goal isn't to, wipe you out for the rest of the day. Because in
Exactly.
Parkinson's, you need high intensity, like you had said earlier, that aerobic. You need that demand for more oxygen. Unlike
Mhm.
some other areas, there's some diseases where we actually have to take, we want to restrict you getting too high, your blood pressure or your blood heart rate up too high. There's some times where you try not to get your heart rate up.
Sure.
But with Parkinson's,
Sure.
we want to get you huffing and puffing. We want you to get you to have to breathe in heavier so you get that brain derived neurotropic factor, that rush of oxygen to your brain that's going to help you and make you feel better after the fact. But it's not designed to knock you out. It's designed to make you want to breathe higher, breathe more, to increase your, um, I'm lost for words, but just get you huffing and puffing. But
Yeah,
not
that's
designed
really it. That's
to
what we
knock
want
you
to
out.
see that. We want to
Yeah.
see that demand placed on the heart. We want to see that excess fresh oxygenated blood get to
Hmm.
those muscle groups.
Yeah.
It strengthens the heart. It regulates your blood pressure. It regulates blood sugar. So there's just a cascade of events that happens when we get to that level.
Hmm.
And you have to make sure. And that's why you need some kind of group or even a one-on-one
Yeah.
training, because you just can't always do this on your own. The minute sometimes we just get tired with and we say, I'm done for today.
Yeah.
But when you have
I
someone
do
there
it
that's
myself
pushing
if
you,
I'm working on my own. Yeah.
yeah, we've all done that.
Hmm.
We've all get to that point. And the other part that's really interesting is the social aspect that
Oh yeah.
happens when you're out there with a group and the camaraderie that goes along with that. That also, again, is wonderful. Socialization skills begin to diminish with Parkinson's because maybe they're afraid of going out in public. They don't want to be embarrassed, or they're afraid of
Yeah.
freezing, or they're afraid of falling. So their social network decreases dramatically with time. And this is an opportunity for them to get back into that. And that, of course, helps with cognition as well. So there's also that added benefit of,
Yeah.
of having that socialization along with that.
Yeah. We call it social motion.
Yeah,
Yeah,
perfect.
way more fun with friends. Um,
Yep.
and you brought up the other day, and we have about 5 minutes left. And but you brought up the other day, because I said get your heart rate up. So and I backed off because I want to be careful talking about heart rate. We do want to get the heart rate up. We want to get you huffing and puffing, but it's not the same for everybody. Some people can get, we look at heart rate for some people because they
Sure.
can, but there's a lot of people as you age and with Parkinson's, you take beta blockers, you have areas where you can't get your heart rate up, right? Or you
Yes.
have to kind of be cautious. So I loved that you brought up the scale of exertion, the rate of exertion the other day, because that's what I use with my people.
Great.
And so, in a nutshell, give us, a 2 minute explanation about how to hit maybe that 60, 70% that we're encouraged to get to without having to rely on the formula for our heart rate.
Yeah. Yeah. So, the rate of perceived exertion is really what they call that. And there are two scales that are commonly used. They're called the Borg scale, BORG. And there's the regular Borg and the modified Borg. And essentially what they do, they're a little bit more subjective than the mathematical formula where you're taking
Mhm.
220 minus your age and taking 60% of that and stuff. So, which is fine for some patients. But a lot of PD patients can't ever achieve that for
Mhm.
many reasons. Either it's the Parkinson's themselves, or as you mentioned, they're on a class of medication called beta blockers. They're never going to get their heart rate to that level. But there are other perceived, a little bit more subjective means that symptoms that we can look at. And what Borg decided was that there are physical external symptoms that we can look for to see if a patient is really achieving what we want them to. The modified Borg really depends more on, it relies on if the patient is perspiring more, if they broken down into a sweat, are they seemed more fatigued? Do they have any muscle fatigue happening at any place? Is their respiratory rate increased more? And there's a whole host, depending upon that scale goes from 1 to 10. You never want to be a 1. That's probably the laziest person on earth. And
Hmm.
the number 10 is someone pushing a small car up the side of a mountain. You don't want to be that guy either. On the modified scale, you'd like to be probably around 4, 5, or 6. That would really put you in an aerobic zone that you would like to be at. And then they can download those scales off the internet. They're all over the place.
Yeah.
And you'll see after each number is a series of symptoms that you should be experiencing after each one of those. And it's very easy for them to match up. No, I'm breathing much heavier than that. Or no, I'm really starting to sweat. I'm not a 3. Now I'm a 4 for sure. And they can do it that way. The other one was the regular Borg. That scale goes from 6 to 20. It's a little bit different, but that emphasizes more on the heart rate. And again, after each number, there's a little symptom that they want you to look at. But what Borg said, look, if the 6 through 20 confuses you, just add a 0 after each of those numbers. And that would really be where I would like to see your heart rate. So if you were on the Borg scale and you were at a 7, if you added a 0 next to that, that would be 70. That's where, at that level, that's where your heart rate should be if you wanted to double check it. But either scale works great. As I said, they are a little bit more subjective because you yourself or your trainer has to decide, do they have this symptom? Do they not have it? But it's at least it's a guide for patients, especially PD patients, to see if they're accomplishing what they need to do.
Yeah, and that's good. Because and I like the rate of exertion, the perceived rate of exertion scale. I oftentimes tell people, if you can, we kind of do it more of, I guess, if you're able to talk versus to like the point where you're working so hard that you can't talk,
Yes,
and
yes,
because sometimes it's actually hard to break a sweat when you're with some people with Parkinson's aren't breaking a sweat. Sometimes their body temperature does weird things.
sure,
Sometimes they break a sweat in 2 seconds. I break a sweat in 2 seconds,
very true.
Um,
Yep,
so we go like, and I'll walk around in class or with my own clients, and we talk a lot or ask questions to see where they are. And if they're speaking like there's no problem, I'm like, dude, come on, there's more
yes,
in you. You got more in you, and so it's just important, I guess, at the end of the day, it's important to bring yourself to a point where it's a challenge on you. Like, it's not easy peasy. You have to get yourself breathing heavier. You don't want to be pushing a car up a hill though, because we don't want you falling over, but we definitely need you to breathe heavier and just be real. Just push yourself to that little point. And oftentimes we go up and down, like,
of
um,
course.
have
Yes,
moments, and I'm a firm believer in interval training, right? I'm a firm believer in pushing ourselves a little bit heavier for a moment or two and then backing off. And that
then back off.
recovery is a good
Yes.
sign of heart health as well.
Yeah, and very often patients get discouraged using the mathematical formula because
Hmm.
they don't feel they're getting anything out of it. When in fact, if they were using one of the other scales, they would
Hmm.
actually see that I am really where I need to be.
Yeah.
It says my heart rate should be 110. I'm taking it, it's only 85. But yet on the Borg scale, I'm showing all the symptoms of where I should be in order
Right.
for my target zone. So I don't want them to get discouraged because, I can never get my heart, no matter how much I work out. And that's dangerous because they push themselves thinking that they're going to get their heart rate to that. And no matter how much they do, it'll never get that because of either the Parkinson's or other medication. So that's why those scales are much more effective for patients like that.
Yeah, that's pretty awesome. And so with that being said, let's wrap this one up because we got some important things to talk about in our next video. I'm excited about our next video to talk about pill load and other things. So in summary, one, if someone's feeling exhausted after exercise, it's really important to share that with your neurologist. Two, hey, you take your medication, you do your exercise, you hang out with us from time to time, and we'll all have a great
That's
time
right.
with this.
That's right.
It is super important to remember they are tag team exercise and medication, and that's why I feel like it's just such a blessing to have worked with you and have you come and share with us at our group. because I feel like that's sort of when I first got into this way back. I've had Parkinson's clients say, what do you think about me not getting into exercise, or newly diagnosed people just trying to push off that first time taking their carbidopa, levodopa, or getting medication. And truly for them, it's probably better to start sooner than later. So we got about
Yep.
20 seconds left. Would you agree with that?
I couldn't agree more. There was at some point in time controversy over that. That later might be better. We might be able to avert some of the side effects, but that's old school thinking. Almost
Mhm.
all neurologists now say, you know what? Let's get them on it. The right dose, as minimal as possible, early on as possible, and get them back to that enjoying the lifestyle that they want to live. And that can happen with early onset. They can do it.
Awesome. With that being said, Bob, thanks so much.